for recurrent pharyngitis, what we should do, sir? Abhyandar chikitsa.
Recurrent pharyngitis. Okay, we had already covered the upper respiratory tract problems, in which I had a very important point of looking into the cost of the patient. Because many of times, if the patient is having a recurrent pharyngitis and the patient goes for a consultation with an ENT, they will give sometimes they will give antacids also, pantoprazole or something, and along with the antibiotics and decongestant, all these are not working. Then we, as Ayurveda people, we will also think, oh, okay, we should also go for antibiotics and decongestants. What kind of medicines in Ayurveda will be working as antibiotic and decongestant? That is actually a, to be frank, it's a foolish thought, because the antibiotics and decongestant have already failed to work. So we are again searching for something which will definitely fail again. So it is not our job to do that. We should check that in terms of whether the patient's costa is okay, whether there is some Prapti of Udavarta, there the so-called GERD, LPRD, that sequence is there, whether the what you call the motion of the patient is very fine, the intake of food, if he's having a very intake of food means heavy meals is being taken by the patient, especially during night, and if he's going to the bed within 2 hours of the dinner, these all can give problems of all kind to the upper respiratory tract. For example, there is something called as a reflux symptom index, RSI. It is being monitored in the Western countries in children with upper respiratory tract infections, recurrent URTI. This symptom index, if it is, I think the score is somewhere around 30, and if it is positive, if it is above 15, then they will give antacids and medicines for the gut, not for the URTA. So that should be eliminated first. And in our case, definitely, Eshasara Chikilsa, Agnehe Parirakshana, Koshta should be, and Agni should be cared first. And then we can go into the other factors, like whether there is any uh, problem in the usage of the kind of things, like whether the patient is having a bath in the wrong time. If the body is heat, the patient is coming out from the atmosphere and going into home, and he is pouring very cold water. So two problems are there. If the body is hot and patient is suddenly pouring cold water on his head, if the patient is very coming from a cold climate and he is putting some hot water on his head, sudden vasodilatation, vasoconstriction can be happening. If this happens for a long time, if he is practicing this as a sheet of vihara for a long time, this can also cause problems. And the usage of wrong kind of oils. In our place, people use oil to promote the hair growth. Such oils are made up of what you call as kumari, also that bringaraj, hibiscus, like that. All the kind of cold potent drugs are being put into that oil and processed, and it will be coldest of oil like kind of Neeli Bringadi oil or the Himasagar Taila of Kotakil. This is also very very cold potent oil. Such oil you cannot use it in all patients, means every person cannot tolerate that much cold potent oil. That can also induce this sinusitis, the condition which you asked as a recurrent pharyngitis, and also the tonsillitis, and all problems of upper respiratory tract can definitely cause these problems.
Okay,
So
sir. Thank you.
selection of medicines is it is as simple as Jarahara, Shobhara, like that only. But these things should also be kept in your mind.
Okay, sir. I have treated that patient as a like a Pittaja condition, and his Koshta was normal, sir, and no means Vatanoloman, everything is normal, sir. Nothing is wrong. Only he, whenever he eats something like raw onion, he gets that it triggers the inflammation, means he, full reddishness. So I have given Avibattikar and Sutta Shekhar also. Like Samapitta condition, I have considered and gave, but still there is no relief.
If it is
One
not
more,
having that much relief, you
the
can go for two
patient.
things. One is to go for a Snehavana of the app drug according to the patient. The second thing is, if still it is persisting, you should be going for Shodhana Chikitsa. I think because it is of upper respiratory tract, you can go for, and try for a Vamana if IP facilities are available.
Okay, sir. Thank you, sir. And sir, one more question I have. Recurrent means if kids go to school longer means in pollution, so they get morning nose block and sneezing. If they are at home, nothing will happen. If they goes to school because of pollution, they get this problem. So how to tackle with this in kids?
In our case, we can use all the modalities. As I told you, you can use it in even normal patients to prevent the problem, like you told. The Kabbalah can be practiced. The Thailas like Ajimedadi Thaila or Asana Villodi can be used for the head. Also, some kind of nasya can be done to the children if it is possible. Not in big doses, simple doses. Prativarsha nasya can be used even without the pathyas or everything. And along with that, the medicines like Haridra and Chanoprasha like that should be given to the patients. In your case, the main problem is that the student will not be having any problem with the nasal cavity. He will not be having DNS. He will not be having terminate hypertrophy, polyp, or anything. This is basically an immunocompromised condition because the children, somewhat older days, they were playing in the soil, they were getting infections, and they were getting the immunity. Now this is a serious problem because they are living in the flats and they are not at all communicating to the external environment. That is why this much recurrent infections and allergies are coming. So the usage of some drugs like Haridra and our medicines which promote bala of the patient, regular exercise, and especially correcting the diet. The things from the bakery made up of maida, that wheat flour, and also the baked things that should be avoided. I mean, all kinds of those lays, noodles, that cream biscuits, bread bun type things. These things should be lowered in children because these are causing allergies in the patients a lot. So, with these measures, generally they will improve. Even it will maybe take a little bit long time, but they will improve. But I have an opinion that in between you should not be uh, using antibiotics to tackle this. It is a
No, sir.
trend in patients and parents to, whenever the child is having a problem, they directly go and give a levocetirizine or cetirizine or Montakelsi capsule or tablet, and then antibiotics. But that is, I don't think the persons the persons in the world who invented antibiotics, the persons in the world who are writing textbooks about antibiotics and their use, they are not using antibiotics as we are using them in India now. That is sure.
No, sir, I'm not using antibiotic. Only Haridra Khanda is okay to prevent recurrence, and like Shunti Siddha Jal, that is also okay.
No, no, I was not telling about your case. You should be yelling. Otherwise, the persons who are hearing this should be able to communicate to the patients. This is not a good solution to give antibiotics at every nook and corner of the life.
Sure, sir. Sir, and what is the treatment for maxillary sinus, sir? I have a patient, her CT scan shows maxillary this polyps. What
Polyps, if they are of which size, you should be able to appreciate. And
that is
along
not
with that,
mentioned, sir. In small polyps, I've mentioned, not the size in
okay,
that scan.
okay.
Scan, no,
Small
no
polyps
place.
can be treated. You just treat, like we told now, for that recurrent upper respiratory tract infection of any kind is treated likewise only. All the modalities like Nasya, Dhumavana, and that I have already explained in the class. That will work out.
Okay, sir. Thank you, sir.
Okay. From the chat box, I have, what is the treatment for autosclerosis? It is a condition which it has got not so good prognosis, but it is like an arthritis condition of the joints which affects the mobility of the joints. Simply like that. So initially we go for Rushna and later we go for Snehavana with the most commonly used thing is Gulgulita. And also in some cases we have gone for Dhanindra Daira Snehavana internally, as well as Karnapurna is also effective. But effective, what I intend to say here is that it cannot be cured definitely, but the progress can be arrested. The patient can hear better. The hearing gets better to some extent, maybe to 10 to 20% improvement will be there. And also the patient will be having a lot of disturbance. It will not be a simple hearing loss. It will be of a kind of hearing loss with also some irritation and disturbance to the patient. That all symptoms can be relieved to the patient. And we definitely should not tell the patient that I am going to cure you. That is actually a tall claim.
Okay, sir.
What can we
Sir,
do in patients of dental caries? Dental caries, actually, if it is deep, it should be definitely dealt with some kind of materials. The kind of things. I think initially they were using some liquid materials that will solidify after some time. Then they were using some kind of silver amalgam. Now I think they are using glass and something like that. So that is an entirely uh, I developed a department of dentistry is there. And in I think now in Trivandrum Ayurveda College and Tripura Ayurveda College, here one dental surgeon is coming, and our students are also learning dentistry from them. From my part, for gum diseases, I am giving Vadarakta line of treatments like Manjishtadi Kashaya and all Rakta Shodhaka Dravyas and Vadarakta Samana Dravyas I am using internally. Also, for gum diseases and pain, I am using Guluchadi Kashaya as gargle. Simply Pitta Shamana, that is the concept. And also Ayurveda Churna, or the drugs with contain Gairiga like Legusuda Shagaras or Stamata. These are which I use in these cases. But it is also giving results. But the problem is that, to be precise, if the patient is having a problem with the teeth ache, is there, we should go for an X-ray of the dentals. And if the tooth is having so much decay into the roots, then they should go for a root canal treatment. In that case, what we can do, that much awareness is not for I'm not that much aware or well versed in that particular condition, because I'm not trained in that. But I have a hope that we are the people, because the industry is developing from our side, in the near future we will have also a reach or a role there.
okay, sir. Sir, we have another question. Sir, when a patient complains with giddiness, what can be the other causes of from the ENT side other than the
Yes,
cervical spondylosis?
okay, that is a very good question, because of the lack of time I didn't go for that individual diseases from the part of ENT. Giddiness means basically patient is standing still or lying down, but he feels that the whole thing around him is revolving around. One presentation is like that. The other presentation is like he's feeling like he's going to fall. So that can be the differential diagnosis. Because of the question, I am going only for the differential diagnosis. Apart from cervical spondylitis, one diagnosis is simply the balance problem, as people call. One reason for it is vertebrobasilar insufficiency, and the second reason can be anemia. The third one can be the vestibular problem, which is addressed with the labyrinthine stenosis. That means there are some things called as otoliths in our inner ear, and the position of the otolith gets changed, and you get a problem like you are having giddiness. And in that case, some maneuvers to correct this, like Applis maneuver, Hallpix maneuver, etc., is there. Then along with that, we will be using our medicines. In case of Ayurveda, the best effective medicines which we, according to our experience, is use of Dusparsha. Dusparsha Gadi Kodha is given in Arshas, but Dusparsha as such, like in Durala Varishta, and Dusparsha as such, if available as Rotrek, given as Kodha, and along with that Gorojanadi Kodha, Kshirabala, these all are very effective in these conditions. Also, in case of anemic patients, we are using Tribhala along with Annabhedi as a solution for the patient. Also, Hingojadi Gudiga and Partharishta. These are what drugs we will be giving. And once the patient is okay, the most effective drug which we use is Ksheerabala Avarti or Ksheerabala plain Thaila for Snehavana, along with neck exercises to improve the circulation to the head as a whole, and particularly to the vestibular apparatus. These are working usually.
Okay, sir. Sir, next question. The treatment for otitis externa. Externa.
Okay. Fungal otitis is the usual case of otitis externa, or it can be also a pus discharge due to maybe due to a furuncle or an abscess in the ear. If it is a simple abscess or furuncle, it should be treated as a pidaga anywhere else in the body. How you treating it, the same should be applied. But in case of fungal otitis, the principle is to make the ear dry. So in case of external otitis, due to fungal infection, the importance of local treatment is also very high. Means we have to use dhupana so that the ear becomes dry and somewhat the presence of moisture is eliminated totally, so that the fungus cannot grow there. And the second thing is that you can also use vartis containing resacrias, like if you can prepare a tribhala kvadha and you make it a thick paste. The kvadha, when you boil and reduce the water content to such an extent that it becomes a paste, in a gauze you are packing it and making it a varti, and you can place it inside the ear overnight and you can remove it out. And in the morning after removing it out, you should wipe clean the patient's ear with the cotton and the Jobson's probe. Then you should go for dhupana twice a day. Internally, all kinds of medicines we use in fungal infections like Tribhala, Gandhaga, Arogyavardhini, all this can be given. Also, external application after dhupana, you can use the drugs containing Gandhaga like Aditya Pagataila for external application also. Generally, they should be applied as very mildly. And if you can keep the ear dry with dhupana, etc., for continuously for a few days, generally the condition comes under control.
Okay. Sir, you mentioned about giving dhupana. So what are the common medicines that we can prescribe for dhupana?
Vyoshadi Varti is given in Shwasa Chikitsa.
Okay.
So that can be made with Vyosha, Haridra, that Haridala, Manasila, etc. You can make a combination. Or simply, as I told, Kaisharugulu as a Gudiga can be made into a powder, and it can be used for dhupana as well as dhumapana. Okay, both this. And also you go into that chapter is there in Charaka Samhita, whereas dhupana drugs is being given as a group, I think so.
Okay.
From those medicines you can select whichever is available, you can make it.
Okay. Okay, sir.
Generally, some Tikshna drugs are usually should be there for infections of a fungal nature. And if it is a purely bacterial infection causing this yellowish discharge and local temperature is there, definitely it is a contraindication for dhupana. You should not be going for dhupana. That is already understood. That is why I am not again repeating.
Okay, sir. Sir, next question. In ear discharge, what are the symptoms that patient will not cure with Ayurveda and can be cured with Ayurveda? How to differentiate in ear discharge?
Okay, that is a very strange question, because only based on ear discharge, we cannot say that it will cure or will not cure with Ayurveda. But as I already told, for that, in case of this cholesteatoma, the discharge is very much sticky. You put a piece of cotton and you bring it out, it will come with the cotton, and you go for a while, even after it will not break. That is the first suspicion that it may be cholesteatoma, which is a surgical condition. Otherwise, the discharge itself with only, I mean, just with the character of discharge, you cannot say that it can be cured or not cured with Ayurveda. You have to see the nature of discharge. You have to see the duration of the condition, whether it is coming from outside the ear or from the middle ear, and if there is a perforation. All this to be kept in mind before we arrive into a prognosis.
Okay, sir. Sir, in Dinacharya, which oil can be used for Nasya and Karnapurana?
Okay. Nasya definitely Anadala is given in the chapter itself. So there is no question about other medicine to be used in Dinacharya. For Karna Purana, we can use plain Tiladela
Okay.
in case of Dinacharya. Also for Gandusha, also the Tiladela is very, very effective because for a lot of dental diseases like dental pain, the loss of enamel, the kind of hypersensitivity, in all cases, simple Tiladela itself is very effective. It can be used for Karnapurna also. Even Karpuraj Daila is also good for Karnapurna in case of a normal patient.
Okay. Sir, can you please describe the exercises for vertigo?
Vertigo specific exercises are there. I mean, one maneuver is there for eliciting the nystagmus of the patient so that in which side the vestibular cochlear mechanism is affected. That is called as I think Holpix maneuver, and the maneuver to correct it is called as Epplis maneuver. And like the Epplis maneuver, some exercises are designed for vertigo. I think I can send a video of that vertigo exercises which can be circulated. That will be more useful.
Okay. Sir, as you had told about the Shira Bala that can be used for giddiness, internally is it Avarti or Shuddha Bala Taila to be used? And what is the dosage?
Internally, if it is Avarti, what I used to do is that if the patient is not having severe symptoms, I will use 20 drops of Avarti twice a day with Partha Arishta or some kind of Arishta so that the Sneha can be absorbed and the patient is more appreciating it. He can use it more easily. Whereas if the patient is having severe symptoms and initially we are managing with Punarnamadi Kashaya or Dusparsha or Gorojanadi or Sudarshana like that, and after that, if the patient is having a history of such strong vertigo, then sometimes I give one bottle, 10 grams of Shirabala Avarti is one bottle, right? Packing is like that only. So one whole bottle of 10 gram will be given in one single day. Like that for 10 days, the patient will be having definite result, very, very good result. And after that, you can give a sustenance dose, maybe 20 drops per day for a long time, or even Shirabala, our soft gel capsules are there. You can give 2 capsules per day. That is also giving good results in the long run.
Okay.
But another aspect is also there. If you think that the content of the drug is not giving result and you think that the patient needs more snehana, content of sneha should be more for the patient, then we will go for plain Shiravala Taila. That will be given in 50 ml per day, like that.
Okay. Sir, next question. What is the management of foreign body in ear? Is it safe to use Purana with lukewarm oils?
That is also given in the our textbooks also. If it is a live foreign body like in an insect or something, and you look with the always look with the otoscope. And if you feel that the ear is otherwise normal, there is no wax or something, and the tympanic membrane is visible, and you're sure, if you're only if you're sure that the tympanic membrane is intact and not perforation, no perforation is there, you can use lukewarm oils in case of insects because that will just kill the insect and I mean the wings of the insect will just get drained in the oil. Then it will definitely at least even if it is not that it will not move. The movement of the insect is the most irritating thing to the patient. And Purana with lukewarm oils in case of a normal ear without perforation is not harmful. It is safe, but maybe sometimes with the oil the insect will come out. If it is not coming out, you will have to remove it with the Jobson's probe after viewing with otoscope.
Sir, one question. Sir, can you please tell us the importance of Murtha Taila in ENT and eye conditions?
Okay. As with the other modalities in the disease of ENT, like we said, Kabala Gandusha Nasya, also Dhumana Dhumavana. Along with that is the importance of Abhyanga. Abhyanga is already told in the Dinacharya because Abhyanga Nityam Sajjara Sramavadaha. Because the thing is that when we are wearing a dress, most commonly we will wear a dress from the neck downwards. So the head is always in contact with the atmosphere. in contact with the wind, in contact with the heat, cold, sunshine, and whatnot. So all the indriyas situated in the head is being in contact with all these forces of nature which have positive as well as negative impact, which will give us a strain. For example, dust will be going inside our ears, in the eyes, which will be washed out by the tears, into the nose, which will be washed out by the mucus secretions on the nose. So the body is continuously fighting with this, so that the man can survive, because the man, human being, cannot always sit inside the house and he can live. So he has to interact with the nature. While interacting with the nature, all these organs in the head and the head as a whole will have some kind of problems to adjust to the external environment. For that, protection of the head and the indriyas, the Murtadala is very important. But at the same time, as I told, the tylas of cold potential like Himasagar or Nilibringadi or processed with the Kumari, so that the hair will be grown. Such a lot of things are coming in YouTube and people are using, but they can give a very negative impact, and they can give problems to the patient like rhinosinusitis or allergic rhinitis or throat pain or headache, chronic sinusitis, and a lot of problems. So according to the tolerance of the patient, the thylas of hot potency like Nagaradi thyla, a little more, little colder ones are Asanavilladi. Really neutral thylas like Murivanna, as well as the potency of the drugs are concerned. Then the thylas which I mentioned of extreme cold potency like Himasagar, Thyla, Nilibrangadi, etc. is there. So that should be selected according to the condition and tolerance of the patient. If the patient is having sleeplessness, we can use a thyla of some cold potency. Whereas if the same patient is having chronic allergic rhinosinusitis, we cannot give them Himasagar thyla or Nilibrangadi. So we will go for a thyla which is of somewhat cold potency but will not cause any allergic problems, like Balagulichadi, Thyla or Balagulichadi Kera, like that. So it is actually an art. I think nowadays physicians are using very less and giving very less importance to Murtha Thyla, but it is important in the life of a patient.
Okay. Sir, another question. Sir, patient aged 42, male, working at construction site. Tonsillectomy done 15 years back. Now recurrent sneezing and runny nose. Using steroidal nasal spray. Which kalpa can be used?
Okay, that I will answer later, because below that one question is there. Sir, can we use Dusparsha if the patient has vertigo with severe headache due to stress? As Dusparsha is covered with the Shapaka or any other Kalpa, we can use more as Vada Samprapti. Definitely, if the patient has a vertigo with severe headache due to stress, the patient should be treated not for vertigo, not for headache. He should be treated for stress. So the medicine for stress should be given, and I think it will relieve his headache and vertigo also. Because one patient came with his wife. Wife said that the husband has vertigo, and the physician asked the wife what is the problem, and the wife said that the patient will lie down on the bed at 10:30, and up to 1 o'clock, 2.5 hours, the patient is holding the mobile phone like this, and his head is like this. And the physician said the wife give him a treat and just throw away the mobile phone and don't allow this. After 3 days, the vertigo was gone. So like that, if it is to distress, treat the stress. Then don't go for this person. And now the question moderator asked me is about the 42-year-old male patient working at construction site, tonsillectomy done 15 years back. Now recurrent sneezing and runny nose using steroid. Basically, 15 years back means he was 27 years old. At that time, tonsillectomy was done. Usually, tonsillectomy will be done before 20 years of age, because that is the age of such diseases. Anyway, now tonsils are gone. He is having again recurrent sneezing and runny nose. Now nothing can be removed. If septal deviation was there, it can be corrected by a surgeon. If there is a turbinate hypertrophy, it can be excised by a surgeon. If there is nothing to remove, then what can they remove? They cannot remove the nose. And if they cannot remove the nose, they have to remove the patient. So they give steroid nasal spray, and after that, the patient as well as the physician gets fed up. but at that time is what is the importance of the whole class which I took today. All the modalities, including the what the moderator asked me last was about Abhyanga. If we use all these modalities correctly and also advise the proper pathya to the patient, he will improve. He will improve and focus on the cost of the patient. Definitely, construction site and the presence of dust is a reason. It will be a reason, but there will be some problem with the patient's diet and his viharas like snana and all. If you focus on that and use the modalities and the principles which we told today, definitely you can get a relief. I think so.
Okay, sir. Sir, already I have given Saraswadarishta meditation Abhyanga Shiropiju told to do, but still no relief in vertigo and headache.
In the case of the second patient with the stress, right?
Jula, you can speak.
Yes, sir. Same patient. Sir,
Okay,
hello.
okay.
Same patient. Because she is 52 years, sir, and her
Okay.
kids, I think it's a psychological because her kids are not here. They are in US, studying in US, and she has more work here also because she stays with her mother-in-law. That also one problem. But she is in
Okay.
the menopause stage, 52 years, and her means her all lakshanas are more vata pitta all. So I have treat means I have considered it is vata pradhan shirashul and vertigo also related to this stress only. This is
I
all
think you
vata
can try three things. One is you can go for a Snehamana with a Grida if it is a Vada Vedika with a higher dose. Like the Vidaryadi Hrida or Drakshadi Hrida as depicted in the Paitiga Vada Vedika Timira. You can try those. And also, you should make sure that there are no other lesions. I mean, you should go for an MRI to rule out some CP angle lesions, cerebropontine angle lesions, or any other serious problems should not be there. It should be ruled out. And even after all these things, if it is persisting, maybe it is purely psychological or because of the mental resistance of the patient after so many years of the disease. The patient itself believe herself believe that I will not be cured like that. So that I think that is why in Satya Sadhya it is given as Nava diseases are Satya, Purana diseases are Kritra Satya or Dusatya. That is because after some time the patient herself feels that all medicines are being tried and now I am not going to be cured. Or maybe she will have some kind of stress that we are not able to get out from her. Maybe it
Yes,
may not
sir,
be.
that is the main problem because she has very avarasattva. I have seen her. She is my neighbor only. I have seen her. She will get scared so easily. She get tense very easily. So that is my. I have convinced her, and I have doing all. I am telling her every time you should not take stress because every day her kids are calling her and telling something problem. They that time also she will get stress.
So I think the treatment is not needed for the patient. Treatment should be
Yes,
given
sir.
for the
Yes.
kids and those who are around her. And you can try one thing. You just become more close with the patient, and you find out what is the most interesting thing for the patient. For example, maybe traveling, maybe watching movies, maybe going for the temple, maybe listening music. So, what excites the patient most should be found out, and for 1 or 2 days, you make her involved in that interesting thing only for 2 days. And if she is not having symptoms in those 2 days, you can be sure that it is psychology.
Okay. Okay, sir. Thank you so much.
Okay.
Sir, one more question. Sir, about the nasal packing that you have told. Sir, duration for how much time, and in a week, how many times it should be repeated, daily or alternatively?
No, it is given daily initially for 1 month. I am using it 1 hour per day, twice daily for the whole month. Then it will be given for 30 minutes twice daily and then 30 minutes once daily. Like that, we will decrease. Once the patient is improving, we will decrease.
Okay.
There are no, I mean, hardcore rules. you can just follow what I said, or even you can do it for some more days, no problem. Once you see the video, it is very easy. In the video, it is being done with the blunt end of the scissors, but whereas you can do it even with the cotton buds also.
Okay. Sir, we'll switch on to the video.
Okay. This is the gauze which is soaked in hot marijuana, and I am just pressing it into her nostril. This patient is having DNS to the left side. So we are creating a packing in the left side that creates the pressure between the what you call the inferior turbinate and the nasal septum. We will leave a tail like that, so that after 1 hour the patient herself can remove that tail. Okay, next video.
Okay, sir. We'll go to the next video.
मम्मी ताला लगा देना ताला कैसे लगेगा तुम्हें
Always use a blunt instrument so that you are not going to hurt the patient, and also it should be soaked in marijuana because then there will not be any friction. If there is a gauze, plain gauze is used, it can cause friction, and there is an area called as Little's area which can induce bleeding in the patient. So be careful. In the initial 1 to 2 days, 3 days, the patient will feel irritation, and they will be complaining of sneezing, and I have a lot of problems. Water is coming from my eyes. I think my eyes are bulging out. All this the patient will tell. But after 3 to 5 days, once the patient feels the comfort of the opening up of the airway, they will be very fine.
Okay. Sir, also one more question, sir. Last one. Sir, we get a lot of cases with recurrent rhinitis. Like the patient complains that they'll wake up in the morning and they'll have an episode of 10 to 15 rhinitis. So,
Sneezing.
yes, sneezing. Yes. So, can you please suggest some medicines to be given to that patient?
In those cases, most probably, in my experience, the patient will be having watery nasal discharge along with this.
Yes.
So what we give is Vadahara drugs only. Vada Kabahara drugs like Dashamula, Induganta Kotha, along with that Vilyodi Gudiga, Govarojana Gudiga, etc. is given. And the most effective tool here is Gandusha as well as Dhumapana. And Nasya with Arkas is being given initially. And in the next stage, we will go for Nasya with Sneha Drivyas. Along with that, Gandusha will be added with the initial phase, maybe Vashadi Vadaga Sainthavan with hot water. Next stage, in hot water, we will use Arimedadi Taila for Gandusha. Same will be given for Abhinda. And even Arimedadi Taila or Nimbamrada Taila will be used for Nasya in the patient. And along with that, internal medicines will be changed to Induganda Hrida, or in some cases, Induganda Hrida will be mixed with Tayus Churna to form a bolus-like thing, and it will be given. In case of children, it is very useful because it's somewhat tastier to have. Like that, it will take some 2 to 3 months, and generally, in I think 70 to 80% of cases, we are getting results.
Okay.
And the difference is that if this patient is consulting in a local hospital in some of the villages of India, they will be given levocetirizine and montelukast. If they are being taken to the district hospital, same medicine. If to the medical college, same medicine. If to the US and the Canada, and even if to the WHO, the same medicine. There are no other medicines. We have a lot of medicines. We can try.
Okay, sir. Sir, there is also one more question. Sir, there are conditions wherein you get small not pimple actually, in the eyes.
You are talking about the stye.
Stye, sorry. Sir, what can be given for the stye treatment?
Stye, recurrent stye, reasons are 4. One is visual acuity problem, I mean refractive error. If there is a refractive error uncorrected, the patient will always keep on rubbing. This rubbing will break the ducts of the glands, and the secretions will be stagnated, and it will get infected and cause a sty. So refractive error, if it is there, it should be corrected, and glass should be prescribed. First one. Second one, if the patient is a child, the Krimi Chikitsa should be given, or if there is a symptoms of Krimi should be taken care of. Third one, if there is dandruff, and also if there is allergic rhinitis, itching is there, the rubbing will be there. It can also, so the dandruff as well as the allergic rhinitis, just we discussed, should be treated properly. And the intake of animal protein, especially intake of egg, that is also a trigger factor of disease. And the treatment, we generally use Sneha Sweda, like we can dip a cotton in hot water and squeeze it, and with that we give Sweda. And you can try Lebanon. If it is painful and an infected one, if it is a sty, we get a good result. But if it is not at all painful, it should not be a sty. It will be mostly a chalazion. And if it is a chalazion, it is called as lagana, and it is also a bhedya roga in our context also. So if it is not responding, then it should be excised.
Sir, another question in the chat box. In pharyngitis patient, how to do Shodhana in OPD basis? Means which Krita we should give Matra, and for Shodhana which Kalpa? And for Gandusha which Drevya, Haridra, Tripala or Yashtimadu in pharyngitis condition?
Because it is an itis condition, I think Haridra can be given, Tripala, Yashtimadu is also good. Pitta Shamana drugs of any kind can be used. But for Shodhana, I think on OPD basis, which Krita should be given Matra and Shodhana? This question needs to be answered, I think, from the Panchakarma side, one thing. The second thing is that that depends upon the patient. I think that question should be answered with the patient in front of us. And depending upon all the other factors, only we can answer that.
Okay.
If the person who asked a question to me, if she can give more details in my personal WhatsApp number also, I can try to help her.
That's the end of the questions in the chat box. If any of our participants who wish to speak or ask any questions directly, you may do so. I've made the unmute button available for everyone.
Hello, ma'am.
Yes, Dr. Jyoti, you can ask.
Good evening, sir. It was a wonderful session, and we came to know some practical aspect like nasal package. Sir, my question is that how to think in the ear discharge, whether we should give treatment or we should refer to the ENT specialist.
Okay, 1 minute. So you need an answer for that question, right?
Yes, sir.
Okay. In that case, I had answered the question, but simply based on ear discharge only, we cannot decide whether we can treat or not. Depending upon the other symptoms, the chronicity of the discharge, whether the patient is so much sick, and you should go for basic blood investigations like blood routine and a CRP. If it is a very high ESR and the CRP is also high, that is the condition exactly which can cause complications like mastoiditis or infections which can go upward into the higher center, even into the brain. So such conditions is exactly where we should refer, and antibiotics are absolutely indicated in that case. That is what Logan Turner was trying to speak in his acute rhinosinusitis chapter. So if the patient is having fever, that is also high grade fever, the patient is sick, and if these markers are also high, we cannot tackle the patient because it will be risky. And I think in the North Indian context with the resort drugs, there may be people who may be tackling this. If you are that much confident enough, you can definitely go. And if the markers of ESR and CRP are high, you should take an extra of the mastoid, so that if there is a mastoiditis, it is going into a worse condition. then also you should refer the patient as early as you can.
Thank you, sir.
Okay.
So that's the end of the questions. So I hope the participants don't have any more further questions. We'll wind up the session here.
Okay.
Okay. So once again, thank you so much, sir, for this wonderful session. On behalf of Ayurveda Map, I thank you so much for being a part of
Okay.
us.
Thanks for the opportunity to the each and everyone behind the Ayurveda map, and special thanks to Radhika, the moderator.
Thank you, sir.
Okay. Good night.
Okay.
Okay, if, Dr. Radhika, if there is any feedback.
Yes. So our participants, if you have any feedbacks, please do share with us. We would love to hear about it. Anyone, you can. I know that you have been posting it in the chat box, but still, we would like to listen it from you directly. So please unmute and speak.
Yes, if there is any other requirement, we will give you the video in your LMS so that you can watch it again. Okay. And if there is any other any upgrade or any help you need, you can just WhatsApp or just chat with us. Okay. So, Dr. Radhika, we can wind up today.
Okay.
And that in Monday, we have the session on the parasurgical procedures by Dr. Simi Ravindra. Okay. So,
So we'll wind up the session here. Thank you one and all for joining us for this live session. So we'll be seeing you with yet another wonderful session on Monday. So till then, take care and thank you. Good night.
दुनिया का 5 मिर्ची उछल के जाए तो वो खांसी नहीं हुआ, नजर लगा हुआ है उसके।
तुम्हारा ही लगा